The Transformation of COVID-Gov, A Tale of Two Administrations and a Pandemic's Legacy. The digital landscape of American pandemic response has undergone a dramatic shift. COVID-Gov, once a vital resource providing crucial information on testing, vaccines, treatments, and long COVID, has been dramatically overhauled under the Trump administration. What was once a beacon of public health guidance has been repurposed into a platform predominantly focused on the contentious lab leak theory, launching a pointed critique of key figures in the nation's pandemic response. This transformation represents more than a simple website redesign. It embodies a fundamental change in narrative and priorities. The previous administration's emphasis on providing readily accessible information to the public has been replaced with a concerted effort to scrutinize the origins of the COVID-19 pandemic and to cast doubt on the established scientific consensus. The website now serves as a focal point for a deeply divisive debate, with implications far beyond the digital realm. At the heart of this controversy lies Dr. Anthony Fauci, the former director of the National Institute of Allergy and Infectious Diseases, NIAID. Dr. Fauci, a prominent figure in both the Trump and Biden administration's pandemic responses, is now the subject of intense criticism on the revamped COVID-Gov site. The site alleges numerous shortcomings in his handling of the crisis, challenging his leadership and questioning the decisions made under his guidance. This attack isn't limited to Dr. Fauci. It extends to the World Health Organization, WHO, New York state leadership, and even the very foundations of scientific research funding. The administration, in statements reported by Fox News, defends the site's transformation as a commitment to transparency. A senior administration official asserted that the American people deserve to know the truth about the COVID pandemic, and we will always find ways to reach communities with that message. However, this claim is met with skepticism by many who argue that the site's content promotes a partisan narrative rather than unbiased factual information. The site's emphasis on the lab leak theory, a hypothesis that remains unproven despite substantial investigation, fuels this criticism. The controversy is further amplified by the fact that the Wuhan Institute of Virology, a key player in the lab leak debate, received partial funding from the U.S. government via the National Institutes of Health (NIH). This funding has become a focal point of criticism, fueling accusations of mismanagement and a lack of oversight. The narrative further suggests President Biden pardoned Dr. Fauci, driven by a preemptive measure to avoid potential attacks from the incoming Trump administration. While definitive answers about the pandemic's origins remain elusive, the scientific community continues to investigate. A recent August 2024 publication in the Journal of Virology highlighted that while researchers remain open-minded, the preponderance of evidence points towards a zoonotic spillover event, a natural transmission from animals to humans. This echoes the origins of other significant pandemics, such as the 2003 SARS outbreak and the 1918 influenza pandemic, both believed to have stemmed from animal-human interactions. The current concern about the potential for H5N1 avian influenza to jump to humans via birds and dairy cows underscores the ongoing threat of zoonotic diseases. In stark contrast to the scientific community's cautious approach, the lab leak theory has gained considerable traction in certain media circles and political arenas. The theory has been embraced by prominent commentators and figures, particularly within conservative media outlets. It has fueled Republican-led congressional hearings, leading to calls for accountability from individuals like Dr. Fauci, and even advocating for reduced funding for scientific institutions like the NIH. The controversy extends to mRNA vaccine technology, the very foundation of the swift vaccine development during the initial stages of the pandemic. This technology, once hailed as a scientific triumph, is now under intense scrutiny, with critics raising concerns about its safety and efficacy. The irony is palpable. Many prominent critics of the previous administration's handling of the pandemic now hold key positions in the current administration. This includes the appointment of Robert F. Kennedy Jr., a longtime vaccine skeptic, as health secretary, and Dr. Jay Bhattacharya, previously a vocal critic of government intervention, now leading the NIH. Their appointments symbolize a significant shift in policy direction and underscore the deeply partisan nature of the ongoing debate surrounding the pandemic's origins and response. The transformation of COVID-Gov mirrors this broader political realignment, shifting the focus from public health information to a platform for contesting the established narrative. The legacy of this transformation and its impact on public trust in science and government will likely be debated for years to come. The repurposing of COVID-Gov serves as a stark reminder of the politicization of public health and the lasting consequences of shifting scientific consensus into a partisan battleground. The implications extend far beyond the website itself. They touch upon the core of public health, scientific integrity, and the future of pandemic preparedness. The debate surrounding the origins of COVID-19 and the narrative surrounding it continues to shape the political and scientific landscapes, with profound implications for the nation's health and future response to public health crises.